Hey guys, what's going on? Welcome back to our Biomechanics series. Today we're going to be talking about the different structures that make up our knee joint. So the knee joint is a really important joint and a commonly injured joint, especially when it pertains to athletes and fitness-oriented individuals. So let's take a look at some of the structures of the knee so we can get a better grasp on how some different forces applied to the knee are going to affect it. So first thing we got to understand about the knee are the different bones that make up the knee joint. So right here we're going to look at the anterior view of the knee, and the main top bone coming down is going to be our femur, right? That's the big, thick thigh bone that's coming down our leg. Right here we have our patella, or our kneecap, as most people know it. And then below those we have the tibia and the fibula, which are the two long bones of the lower leg. There's a couple major osteology points on these bones that are going to be important for us to at least be aware of. So on the femur we have the two femoral condyles, the medial and the lateral femoral condyles. Those are really important because those are going to be big attachment sites for some of the major muscles of the upper leg, as well as some of the ligaments of the knee. We have the patella, which, as we noted, is the kneecap, and that's important because that's going to be the attachment site for our patellar tendon. And the mobility of this patella is going to allow for us to have good flexion and extension motion of the knee. Okay? Down on the tibia here, we have the tibial tuberosity, and that's going to be that little bump you feel if you reach down and touch below your kneecap on the front of the shin there. That's the tibial tuberosity, and that's the lower attachment point for our patellar tendon. So that's a major attachment on the tibia. And then we have the pes anserine on the, just medial to the tibial tuberosity, and that, similar to the tibial tuberosity, is going to be an attachment point for some ligaments as well as some muscles of the upper leg. Okay, so those are two pretty big attachment points right there. Okay, and then on the fibula, it's just worth noting that the fibular head, which articulates with the tibia, is also going to be an attachment site for some major ligaments of the knee. Okay, so as far as osteology goes, those are the major bones and osteology points of the knee. Now let's take a look at some of the soft tissues of the knee, like the ligaments and the menisci, and understand how those are important for the knee joint. So we're going to start by looking at the medial and lateral collateral ligaments. Okay, so on the medial side we have the MCL, or the medial collateral ligament, and on the lateral side we have the LCL, or the lateral collateral ligament. Okay, and the main purpose of both of these ligaments is to check basically lateral and medial translation of the femur and the tibia on each other. Okay, so the MCL is going to check valgus force of the knee, okay? Or so that's going to be when the knee is kind of angling inwards. The LCL is going to check varus force of the knee, and that's going to be when the knee is angling outwards, okay? And so really lateral and medial translation of the knee is going to be the main thing that these two ligaments are checking, okay? And that can mean, the femur moving in translation to the tibia, or the tibia moving in translation to the femur, okay? So both of those movements, as long as they're sliding across each other, that's what these are really helping to check, okay? Now let's take a look at the lateral view of the knee, okay? These are going to be the ACL and the PCL, or the anterior cruciate ligament and the posterior cruciate ligament. Now, similar to the MCL and LCL, these are going to be checking translation, but instead of lateral to medial, it's going to be checking anterior to posterior translation, okay? So we can see in orange here, that's going to be the PCL, and that's going to check posterior translation, right? So whether it's the femur or the tibia translating posteriorly on each other, okay? The ACL, which everyone is very familiar with, the ACL, the anterior cruciate ligament, one of the most commonly injured ligaments in the body, that's going to check anterior translation of the knee joint, okay? And so just like we said with the MCL, LCL, translation of the knee, but anterior to posterior is what these ligaments are helping to check, okay? Also from the lateral view, we're going to be able to have a good view of the quadriceps tendon and the patellar, technically, ligament, okay? So the patellar ligament, a lot of people know as the patellar tendon, but technically it is a ligament because it's connecting the patella to the tibia. That's going to be, that front of the knee ligament that you can feel, and that's where we talked about previously. It's going to be attaching on the tibial tuberosity, okay? So the ligament runs from the lower side of the patella down to the tibial tuberosity. The quadriceps tendon, that's going to be the common joint or common, attachment of all the quadricep muscles, and that's going to come down, they join up, and insert on the top of the patella, okay? So that's the quadriceps tendon. It's technically like one common tendon, so it's a tendon that turns into a ligament, but you know, as we can see, the quadriceps come into the top of the patella, and then it slowly becomes a ligament as the patella attaches to the tibial tuberosity. Okay. Lastly, let's talk about the menisci. Okay. So we can see here on an axial view, right? So that's like if you cut the knee in half and we're kind of looking down from the top of the knee. Okay. So the menisci are basically two C-shaped suction cups that are going to help increase joint surface area so that the knee can rotate and flex and extend on the tibia. Okay. So as we said, they're kind of these two C-shaped suction cups, and the way that they hold onto the knee joint is just going to make it easier to slide on it while also providing a little bit more stability than if it was just a flat surface. Major thing to note for the menisci is the vascularization of them. So the outer third of the menisci is actually pretty well vascularized and heals pretty well, whereas the inner 2/3 of the menisci aren't vascularized well, and so when those are torn, a lot of times that's going to require surgery to repair because they just don't have enough blood flow to heal on their own. Okay, so that's important to note, is the menisci really are helping to increase surface area and allow the joint to slide freely on itself. Okay, so as we can see, we have the major bones of the knee, we have the soft tissues of the knee, right? And all of these things are going to help affect this different stability and mobility that we have within our knee, okay? So that's kind of sums it up for today. That's the major structures of the knee. Tomorrow, we're going to take a look at the different functions and motions of the knee and how they can apply to sports and exercise. So if you guys like the video, give us a like, comment, subscribe, and we'll see you guys in the next one. Thanks.